Hello, I am Yeonsu Oh. I am a professor of the Department of Veterinary Pathology, College of Veterinary Medicine, and Institute of Veterinary Science in Gangwon National University. Today, I will give you a talk about the lumpy skin disease and African horse sickness. Lumpy skin disease. Lumpy skin disease is an acute to chronic viral disease of cattle that is characterized by skin nodules, fever, and generalized lymphadenitis. The disease often results in chronic debility, reduced milk production, poor growth, and infertility, abortion, and sometimes death. The LSD is listed as a notifiable disease by the World Organization for Animal Health due to the severe economic impact on the cattle industry. As you see here, the very characteristic the skin nodules are spread up, covered up all of the animal's bodies. Then look at his or her look at her face. So it looks very sick with a lot of nodules, and she presented very emaciation all around her body. The incidence in animals, the cattle species is the 1/3, the most prevalent, more than 30% to report to so far. And the buffaloes and the 1.6%, Arabian oryx and giraffe, impala, and yak. Its economic impact is the loss of production because of severe emaciation. Once the virus infected, the animal didn't eat at all. We can easily imagine with the severe virus infection, then no animal can eat. And the lowered milk production in case of dairy cattle, and abortion and secondary mastitis, loss of fertility, and extensive damage to hides, and the loss of draft from lameness. Etiology. It is because of lumpy skin disease virus. The virus is a single-stranded DNA virus, and it belongs to the Poxviridae and subfamily, the Cordyceps. The genus is a Capripox virus, and the species is lumpy skin disease virus. They're closely related to sheeppox and goatpox, and it cannot be differentiated with serology. As you see here, this is after infection with the lumpy skin disease virus to the cell culture, and then the electron microscope showed us this firm, rigid virus particle. The elastase tolerance in environment is very sturdy. They recovered from skin nodules kept at minus 80 degrees Celsius for 10 years, and infected tissue culture fluid stored at 4 degrees Celsius for 6 months. Very resistant and susceptible to alkaline or acid pH, and susceptible to ether, chloroform, formalin, and some detergents such as sodium deoxysulfate. They survive in the necrotic skin nodules, the 30 days or longer, and the desiccated crust up to 35 days, and in air-dried hides it's 18 days. Epidemiology is started since the 1928 to 29. First LSD outbreak in Zambia, and 2006 is the Middle East. It goes up to the Middle East here. And then 2012 to 13, Syria, Jordan, and Lebanon. Then 15 is expanded to Southern Europe and Central Asia, including Russia and Kazakhstan. The July 2019 LSD outbreak officially reported in Bangladesh. This is the first South Asian entry of disease. The August 2019, finally China and India. The June to November 2020 is in Nepal, Vietnam, Bhutan, Hong Kong, the Myanmar. Once entered to the East Asia, the Asian countries, the very distributed quickly. The April to May 2021, the Thailand, Malaysia, Laos, and the February, March 2022 in the Indonesia and Singapore. Almost all countries inside the continent is affected by this virus. The first outbreak of LSD in South Korea looked like this. This one is a spatial distribution of LSD cases in Ganghwa area in Incheon. The clinical signs, first of all, clinical signs, the fever comes up. The fever then may exceed 41 degrees Celsius, marked reduction in milk yield in lactating cattle, depression, anorexia, conjunctivitis, and excessive salivation, enlarged superficial lymph nodes. Pregnant cows may abort and be in unestrus for several months. The bulls may become permanently or temporarily infertile. Anyway, the female and male cattle species affected by the LSDV in infertility. Cutaneous nodules 2 to 5 centimeter in diameter develop, particularly on head, neck, limbs, udder, genitalia, and perineum within the 48 hours of onset of the febrile reaction. These nodules are circumscribed, firm, round, and raised, and involve the skin, subcutaneous tissue, and sometimes even the underlying muscles. Maybe around here, underlying muscle, the subcutaneous tissues that are affected. The large nodules may become necrotic and eventually fibrotic and persist for several months. The scars may remain indefinitely. The small nodules may resolve spontaneously without consequences. Look at this other is also affected. The morbidity widely variable. The 3 to 85% very wide variety of morbidity was shown, and the mortality the usually low 1 to 3%. Yeah, it is also the mortality can be raised up on to the 85% in some outbreaks, but usually the mortality is low. The postmortem lesions is looking like this. The bovine nasal turbinate. Nasal turbinate means inside organ. Not only outside skin, but also inside organ can be affected by the LSDV. And because LSDV very tropic to the epithelial region, and this area is also mucous epithelial region, so that is why the LSDV can affect these areas. Look at this. The center of a well-developed pox are necrotic. Around the necrotic area, the very hyperemic, we call that acute hyperemic, and the blood vessel activation, we call that. And acid fast are usually raised above the level of the surrounding skin and granulation tissue. Under this tissue has the granulation tissue. In dead animals, the nodules are found to occur in visceral organs, right? After necropsy, we can find a lot of visceral organs. The epithelial surface of the visceral organs were affected by the LSDB. All lymph nodes are enlarged. Look at this. The trachea to coalescing mucous macules have hyperemic margin. This one is in the hyperemic, demarcated but poorly demarcated around for the focus, rimmed by the mild hemorrhage. This one is the marked generalized interstitial pneumonia around here, and a small cluster of red nodules on the lesion. The histopathology says to us This one is hyperemic, and the ballooning degeneration of epithelial cells, right? Another histopathologic appearance of skin lesions of the cattle with LSD, epidermis with acanthosis. Acanthosis means that our epithelium has a couple of layers of cells. The one layer, we call that acanthosis, acanthocytes or the spinocytes. Those areas are the bigger and hypertrophy. We call that in case of that lesion, we call that acanthosis. The vacuolization, epidermal cells, and spongiosис of degenerative changes in epidermis, and inflammation. We can see inflammatory cell infiltration under the subq, in the subq, and hyperkeratosis, the upward hyperkeratosis we can recognize. And the E is the degenerative changes and intracytoplasmic inclusions. The virus remain to leave their signs inside of cells as inclusion bodies. Okay, this one is also inclusion bodies. The ballooning degeneration of cells, affected cells. Another one, ballooning degeneration. Look at this, ballooning degeneration. And this area, the edema, and the C, eosinophilic intracytoplasmic inclusion bodies. Inclusion bodies are appeared. And D is a characteristic eosinophilic intracytoplasmic inclusion bodies. Those pictures are said there are inclusion bodies left by the virus. Diagnosis were performed by the clinical signs and laboratory tests. The clinical signs, the characteristic skin nodules can say everything. And fever, lymph nodes, enlarged lymph nodes. And the laboratory tests include the virus isolation and identification, the electron microscopy in combination with history. The serology can be tested, but the cross reactions with other poxviruses may occur. So at least two more tests should be done simultaneously to confirm the case. And treatment is antibiotics for the secondary treatment after recovering. The treatment was done by some countries, not our country. The treatment can be done even if the LSDV was infected to animals, that animals can survive, and they raise LSDV positive animals. That countries can think the antibiotics treatment. The use of diclofenac gel in the skin swelling region and application the sulfonamide powder and a nodular lesion was found. And some kind of the drugs can be applied to treat. And the ethno-veterinary treatment can be thought by people who want to raise their animals even if it is infected by the LSDV. Ethno-veterinary medicine means the considering traditional practices of veterinary medicine. It is legitimate and seeks to validate them, actually. Mix well and paint the animals for 10 to 15 days and the lesion will subside. This one is ingredients of the ethno-veterinary treatment. Look at this, the before animal, the after that ethno-veterinary treatment, and then she has a clean skin. She as well. The control and prevention is the immediately notification to authorities. In a federal side, area veterinarian in charge was distributed to that infected infection area, and a state veterinarian also perform measures, and quarantine measures were considered. In case of endemic areas, vaccination of cattle is the option, and insect control together. In the non-endemic areas, they are the keep free with important import restrictions, quarantine strictly, and depopulation and proper carcass disposal and cleaning and disinfection were applied. Those are the disinfection materials. Take a look. But keep in mind, the virus can survive up to 35 days in the environment in desiccated scabs. So that is why the environment disinfection is very important. Okay, vaccination is the option in endemic areas. The vaccines are the attenuated LSD strain used in South Africa, needling strain. So does the Korean quarantine policy. The needling strain vaccine confers immunity up to 3 years. It is designated in a label. The sheep and goat pox vaccine also can be options and are used in East and North Africa that may cause local and severe reaction.